Matters. I'm Kathy Andrews. Today we're going to have a fun show. We're going to talk about exercise. Yes, exercise. And the impact of exercise on your health. Do you want to feel better, have more energy, live longer, look better? Forget the Botox. Exercise. I've got Dr. Patricia Riddle in here, and she's looking at me. What are you talking about? Forget the Botox. Well, there are many health benefits of regular exercise. Exercise controls weight by burning calories. Exercise combats health conditions by keeping the blood flowing, which decreases heart disease. In fact, research indicates that regular physical activity prevents or manages stroke, diabetes, depression. You want to feel better, you want to feel good, exercise. In fact, certain types of cancer, arthritis, and the list goes on. Our guest today is the wonderful Dr. Patricia Riddle with Family Health Centers. She is an internist. She does weight management and a few other things. She creates beauty. Let's just put it like that. We can talk about that. And we also have with us Dr. Andrea Rodriguez. She is the owner of Orangeburg's Gold's Gym, and she's a former professor at South Carolina State University. In fact, Gold's Gym in Orangeburg won Best Improved Gold's Gym in the world. Yes, folks, I've been there. It is spectacular. In fact, you can watch a movie in the gym. That's right. See, I would be in there watching movies. You can go to the steam room. It's quite a gym. It's a wonderful gym. But let's get back to the topic, exercise. If you have certain health problems, of course, you should see a physician first. Heart trouble, pains in the chest, high blood pressure. You should get a physical if you're over 65 before you start any exercise program. But say a person wants to start exercising, but what do they do first? How do you start? What's the first thing a person should do before starting an exercise program? And either one of you can answer that question.
Well, the very first thing that I've noticed, and I've been in this business for over 30 years, is people don't have the motivation. And that's the main reason that they'll walk into our doors. Usually they come in when they're 25 to 50 pounds heavier than they originally wanted to be. It's a lot easier if you can just maintain and be pre-disciplined with the whole issue of weight gain or weight loss or whatever it is that your body is going through at this time. But we will provide the motivation for you. Just having someone there and knowing that someone's going to be there, even if it's a personal training session when you initially come in and you know you have that appointment and someone is expecting you, that's the first step in at least coming through the door, and then we take it from there. We show you exactly what to do. We take you through your journey. We help you with your supplementation, and little by little, it's baby steps if you're not used to it. The whole body modifications and the types of things that your body's going to go through and the soreness, we take you through it step by step, and all we ask is that you take those little baby steps with us, trust us, and in the end, after about 2 weeks, it's going to become a lifestyle. And that's our main goal, is to instill that in your brains, that it's going to be a lifestyle change that you're going to do for the rest of your life, especially if you want those results to stay.
And what if you have a physical issue, Dr. Riddle? What if you're diabetic or you have heart disease? What should you think about before starting a program?
I think if you do have heart disease, it's good to get a sort of clearance from your primary care doctor. But even so, most people with heart attack, we always encourage them to do exercise, but we start at small steps first. Maybe a little walking, maybe 15 minutes a day until they can go up to their maximum. So most patients after a post-myocardial infarction do have to start exercise. That will increase blood flow and will help them to feel better. As far as the diabetics, I always tell my patients that exercise is their built-in insulin. And what happens if a person is diabetic and the sugar is not doing well, after they start exercising, they can actually see within the same hour after exercise, they'll see that their sugar has dropped maybe up to 15 to 20 points. So it's very important, and this will allow them not not to take as much insulin, not to take as much pills. So I do feel exercise is very important to any sort of disease processes. And come to think about it, exercise and depression. When you exercise, you increase an hormone called endorphins. This is what we take when we take a SSRI in the antidepressant medication. This is what increases in our body, endorphins. But exercise can do that naturally. So when you exercise, you increase your endorphins, which is a happy hormone, and you'll start feeling better, happier, and looking gorgeous.
And looking gorgeous. Something that you specialize in, the total body, exercise as well. But, you know, I've seen photographs of 70-year-old ladies who exercise, and they don't need the Botox or the facelift or anything like that. I mean, I'm telling you, have you seen that there's a African-American woman? She's in her 70s, I believe, and she's a bodybuilder, and she looks like she's 40. So it can actually make you look younger.
Yeah, I agree with you. And there's no time in your life that's too late, because this lady started in her early 60s to do this, and she built up muscles, strength, and she looks gorgeous. So not to say if I'm over a certain age I cannot exercise anymore. You can do it for the rest of your life until you're 100 years old or over. So you're always going to feel good and you're going to look better.
So how old is your oldest exerciser at the gym?
We have them as young as 10, 11, 12 years old that come in to work out with their parents, and I think the oldest person we have in there now is 92.
92.
Yeah.
Now, 92. So what does a 92-year-old do?
They can do a lot of exercises on the track. They love to walk. They love the treadmill. They do light weight training with the dumbbells. They do whatever their body tells them they can do when they initially come in. But the main thing is, I just feel as long as your mind is there and you have a clear brain and clear head and you can still physically walk and your doctor hasn't put any limitations on you, as Dr. Riddle said, there is no age limit to doing something physical, at least every day.
Now, if you're 92, usually you've had hip replacement or knee operations or something like that. How do you deal with that?
It goes back once again to the limitations set forth medically, and if those aren't too severe, we just follow those particular orders coming from the doctor. And a lot of the individuals enjoy the water therapy inside the swimming pool, which takes all the resistance off of the joints, and they can move a lot freer in the water.
So say I want to lose about 20 pounds. How long is it going to take me to lose 20 pounds and lose a little body fat? Say we got a little stomach fat from sodas, which Dr. Riddle often tells me about. I have a Coca-Cola or some type of soda. You don't drink that sugar. That's why you complain. That's why you got to suck in all the time. So tell me about that. What should we eat while we're exercising?
I think exercise really goes hand in hand with a good diet, a lifestyle change. And I do find that once you start exercise, you will find a need that all the bad foods you've been eating is not very popular anymore in your body. I think I've seen for a lot of patients, once they start exercise and feeling good, they started thinking that, the soda is not good for me, that white bread is not good for me, so they change their diet entirely. Well, of course, sometimes this also is good when you have someone to lead you, because you have to be able to tell people what to eat. A lot of people do not know. They think all the starchy food are the best food, and all the sugars and the donuts and the sodas. And so sometimes
they are good.
You have to direct them, and once you give them a little synopsis of what's good and what they should have, then it's a whole picture. With their exercise, they're feeling better, they will continue to do good.
Okay, well, you didn't answer my question, but when we come back, Dr. Rodriguez is going to tell me how to lose 20 pounds and lose a little stomach fat and become a bodybuilder like this 70 or 90, I think she's 90 years old actually, 90-year-old lady that we see on the internet all the time. We'll be right back with Health Matters.
Asthma is one of the most common lifelong chronic diseases. 1 in 14 Americans live with asthma, a disease that affects the lungs, causing repeated episodes of wheezing, breathlessness, chest tightness, and coughing. Asthma cannot be cured, but it is possible to manage successfully by knowing the warning signs of an attack, avoiding things that may trigger attacks, and following the advice of your healthcare provider. Let Family Health Centers assist you with your healthcare needs by scheduling an appointment today at 803-531-6900.
Breast cancer is the second leading cause of cancer death for women. The month of October is to acknowledge Breast Cancer Awareness Month. 1 in 8 women will be diagnosed with breast cancer in their lifetime. If breast cancer continues at its current rate, 10.6 million women will die from the disease in the next 25 years. Breast cancer can also occur in males. How can you help? You can help by donating, fundraising, volunteering, or becoming a sponsor. Breast cancer deaths have been declining due to enhanced screening, increased awareness, and new treatment options. The National Breast Cancer Foundation provides free mammogram screenings. You can also do self-examinations, where 70% of breast cancer is found through. Go to nationalbreastcancer.org and see how you can make a difference in your community and be informed. Every day offers another opportunity for someone's life to not have to be at risk, and that someone could be you. Together, we can prepare ourselves for the unexpected by doing one simple thing: getting tested. This is a message from your friends here at WSSB 90.3 FM.
Hi, my name is Kelsey Butler, and I am the 77th Miss South Carolina State University, and I listen to WSSB 90.3 FM.
Welcome back to Health Matters. I'm Kathy Andrews. I'm here with Dr. Patricia Riddle. She is with Family Health Centers, and Dr. Andrea Rodriguez, owner of Gold's Gym here in Orangeburg, South Carolina. We were talking about how to lose 20 pounds. How long will it take me to lose 20 pounds?
That is a question that I get asked just about every day, and exercising is a discipline, and I've had women come in wanting to lose even 15 or 10 pounds, and they'll come in for one day. I don't see them for 2 weeks. This has to be consistent. You have to stay on the program, working out a minimum of 3 times a week, getting in at least an hour each time, and you can't come in and burn 2,500 calories and then leave and intake 5,000. You're not going to see your results that way either. So we do go over the eating plan with you, the supplementation plan. And another thing that I hear a lot is, I put on baby weight and it never came off. Well, what did you do when you put on the baby weight? It doesn't come off by itself. Wishing it away doesn't take it off. It's a science behind it, and you come to the professionals who know how to get you through that particular formula or science as far as weight loss and getting fit is concerned. And just as when you get ill, you go to someone who knows how to make you better. You gain weight, you come to the people who know how to help you lose it, whether that be a weight loss center or a fitness center. But get help and start today. It's never, ever too late.
So you can just start by walking. See, I walk around the house one time, and then I get in front of the television with Chunky Monkey ice cream.
The walking thing, you have to get your heart rate up to 142 beats per minute to lose weight. Usually that can only be done on a piece of machinery because most people can't jog for that length of time on their own. And once you get a feel for how fast a pace you have to walk, usually on the treadmill, we let you physically see how that feels. You'll see it's a big difference than simply just strolling, which is not going to do you much good.
Now, what about supplements? You know, I have a friend. She goes and gets her colon cleansed. She lives in Washington, D.C. This was a big fad a few years ago, and she was telling me, she said, listen, you will lose, I know it's not a very nice thing to talk about, but you will lose 5 to 10 pounds if you go through this colon cleanser treatment. And I was like, oh, girl, please. But there are supplements like colon cleansers as well as protein supplements that will help you with your weight. Is that not correct?
Yeah, that's correct. Sometimes before you start a weight management program, it's always good. A lot of people are constipated and they're just bloated, and it's important to sort of do a colon cleanse maybe for a few days or a week before you start the program. We also look at some patients too. I've read that there's some bad bacteria in somebody's GI tract that in obese patient, they have done some research and they think some of these bacteria also prevent them from losing weight. So I do put the patient dependent on some probiotic. You can get it from yogurt, but that's not enough. So sometimes you can get some probiotic pills over the counter at Walmart, any of the drugstore, and help to get rid of this bad bacteria. Other things we've noticed, and in my practice, which is Oasis Skincare, I notice a lot of obese patients or do have a low vitamin D level. And they said that vitamin D is a miracle drugs right now. It helps, depression. It helps your blood pressure. It helps a lot of things, but also it helps your immune system, and it also helps to metabolize fat. So one of the things, what I do first under my obese patient is to get a level of vitamin D level as well as some thyroid, just in case they could be hypothyroid. So I get a TSH and a free T4, which is a test just for thyroid, and see how is that going, whether it's abnormal, and so we can work from there. So initially we do the colon cleanse, we do some vitamin D level, and we also check a thyroid to make sure these are not holding them back, and we also start them on a supplement of probiotic before we start the program.
Now, what foods should we eat? Now, I was just joking a few minutes ago. My intern and I often talk about Chunky Monkey ice cream because we love this ice cream. Crystal, she's over there filming right now. I like ice cream. I like potato chips. And I also like fruits and vegetables. So and it's difficult to find food, especially in the South, that does not have salt or sugar. So, what do you recommend one eats to have a, body like you guys? What do you eat, Dr. Rodriguez?
The only thing that I can help people with, because nobody's going to completely cut out sweets and salt and junk food. Nobody's going to completely do that, but I'd say start with the simple things. If you like broccoli and cheese, omit the cheese. If you like
the cheese.
Yeah, just omit the cheese. Start with that. and if you like sodas, instead of the 12-ounce portion, just buy the little tiny cans. Start cutting back a little at a time. When you order desserts, instead of each person ordering one, share the dessert. Don't put any additional salt on your food if you're in a restaurant. And sometimes when you go in, there's a lot of healthy options available. You just have to look very carefully. Some of the menus do offer a low-calorie option. I noticed that at one particular restaurant, they have a turkey burger, and you can order that without the bread. They can just bring you the turkey. You can get the lettuce and tomato. If you bypass the ranch, Thousand Island blue cheese, all of the creamy base dressings, and stick with your olive oil. Yeah, stick with your olive oil and vinaigrette. That's another way of cutting back just so much of the fat that you're consuming in one particular sitting. Look for ways that you can cut back on the fat absorption.
Now, give me an example of what you eat. What is a good daily for breakfast, lunch, and dinner?
I try to get protein. Protein is the number one way in which your body can burn calories or lose weight. And we need at least 5 servings of protein a day. And most people don't even get but 2 because they're eating so much starch. And the more starch that you eat, and Dr. Riddle can elaborate on that further, raises your glucose levels. And every time your glucose is raised, your body's going to release insulin, and then you store fat. That's the main reason they say stay away from the rice and the white breads and the sugars. And the only way to really combat that is to ingest more protein. And if you're a vegetarian, you're going to need to find your sources of protein from more of the soy products. If you're a meat eater, then lean sources, turkey, chicken, fish, and at least 3 servings a day and maybe 2 protein shakes.
You were saying something, Dr. Riddle, about the food?
Yeah, I agree with Dr. Rodriguez. But when I do have clients or patients, when they come into my program, they want it now. This is American way. They want it now. I want to lose so much weight now. So I'm a little bit more drastic. I interview them to see what they're eating, what their daily intake, what they have for breakfast.
And what are they eating?
Grits for breakfast. And they have a lot of macaroni and cheese and all the,
all
donuts
Starches.
and soda and starches.
And so cut all of that out.
So
no more fun.
Especially since I do have patients who are diabetics and they have high cholesterol and hypertension, high blood pressure. So once we start doing that, we start going through a program for them and said, okay, this, you cannot have that. You cannot have that. But I introduce more protein into their meals. And the protein sort of get you much fuller. So you don't don't have to be eating and snacking every time. Whereas the carbohydrates, after you're eating in 2 hours, you're feeling hungry, so you're going to have more. So I encourage them to have more fiber in their diet, to have more proteins in their diet, and to take out the sugars as much as possible. So I start them on
all the good stuff. We're going to talk more about exercise when we come back. I'm Kathy Andrews. You're listening to Health Matters.
Blood pressure is the force of blood vessels as blood flows through them. This pressure naturally rises and falls during the day, but when it is constantly too high, it is considered high blood pressure. High blood pressure is a silent killer that sometimes has little to no symptoms, so you may not be aware that it's damaging your arteries, heart, and other organs. Let the Family Health Center help you monitor and control your blood pressure by calling 803-531-6900 to schedule an appointment.
WSSB is supported by the Orangeburg Young Professionals presenting the 7th Annual Bark in the Park, a fun family day featuring contests for children and pups, trick-or-treating, food vendors, and more. This year also introduces the Remembering Riggs River Walk, all at the Centennial Park in the Edelstow Memorial Garden Saturday, October 24th. Walk registration begins at 9 a.m. Bark in the Park begins at 10. Information is available by calling the Chamber of Commerce at 803-534-6821.
WSSB is supported by you, and the Downtown Orangeburg Revitalization Association presents the 19th Annual Taste of Orangeburg Fall Festival. This community event features live music and cuisine from vendors throughout the region. Sunday, October 25th, noon to 3 in downtown Orangeburg, Memorial Plaza Square. More information is available by contacting Jennifer Hastings at 803-531-6186. Dora is all coming together.
This is Coach Buddy Pugh. You listen to WSSB 90.3 FM. This is Coach Buddy Pugh. When I'm out and about, I listen to radio station 90.3 FM.
Welcome back to Health Matters. I'm Kathy Andrews here with Dr. Andrea Rodriguez. She is the owner of Gold's Gym, and Dr. Patricia Riddle with Family Health Centers. She also has her own practice here in Orangeburg. We were talking about losing weight, and I have a friend who's a bodybuilder, and I would love to have a chiseled body. How long does it take to get that, get those muscles? And our intern, Daniel, was talking about exercise confusion. And I'm like, what is that? What is exercise confusion? And realistically, how can one get that chiseled body?
I think exercise confusion refers to when someone comes in and they state what particular goal they have for their body, whether it be to lose weight or gain weight. And bodybuilding is a whole different category. It's a specialization area, and it takes quite a bit of supplementation. It takes quite a bit of diet change and a lot of discipline to what you're eating in order for your body to gain lean muscle tissue and at the same time burn the fat in between the muscle tissue so that you grow but yet not get fat. And that's a very specialized area, and we usually talk with people in length about that, and some people have been doing it for years to get to the point at which their bodies are at when you do see them big and chiseled, or females when you see them a little bit larger than your average female is. It takes quite a bit of knowledge and time in order to get to that point.
And we see the females, and for some people it's a turn on, for other people it is a turn off. And a lot of people are purchasing drugs off of the internet, and we've heard of doping in athletics with Lance Armstrong and other people. So realistically, to get that kind of body, how long does it take? And when we see a woman who is now, when we look at Serena Williams, to me, she looks like she's just, she's been pumping, that's natural. But some women, it does not look natural. But again, What's your opinion on that? Are these women taking testosterone?
Well,
a lot of them?
I can't really talk from the medical standpoint, but if you're going to do any type of hormonal replacements or hormonal treatments, then definitely do it through a sports medicine facility or a doctor knowledgeable in that area, because the body and its changes can be hormonal, whether it be testosterone or whatever it is you're using to increase muscle mass. But if you're going to get into that area, then definitely do it through a licensed physician.
Now, what about pain level? Exercise can reduce pain. I'm told it can, if you have arthritis, that exercise can actually reduce your pain, but it can also increase your pain. So talk about the pain when it comes to exercise. What's normal pain and what's not?
Well, most people, when they do start exercise initially, they're going to have what you call a sore muscle, and this is real lactic acid built up. But after doing that for a while, the body become adjusted, and you don't feel that soreness in the muscle anymore. As far as joints, a lot of my patients, just to say colloquially, they will tell me, "Oh, doctor, when I got up this morning, I could hardly get up out of the bed. I was so stiff." And I would say to them, as the day goes by, "Is it better?" She said, "Oh, yeah. How did you know that?" Because what happened, you have fluid between the joints that helps to lubricate that joint. So as you start moving, that lubrication becomes better and it's not as stiff anymore. So I think with exercise at different levels, of intensity, that it will help your arthritis to feel better. If you can exercise, whether it's going to be walking slowly on the treadmill or do some slow exercise, that will help your muscles and your bones to feel better.
Now, I've heard people say, it's going to rain. You're going to feel it today. Is that true? Does the weather have any type of impact on whether you're going to have pain when you get up this morning? I talked to my mom. She said, "Oh, it's raining outside," or a lot of elderly people, and they say, "Oh, it's raining. I'm feeling that pain today."
Yeah. Well, as a doctor, I don't want to knock it out of the ring, because a lot of times my patient will come and say, "Doctor, my blood pressure is up because it's that old pork I ate, and I don't know," and they will tell you that it's going to rain, so I'm going to feel some joint pains, and I don't have joint pains, so maybe there's some true information that we're getting from these old folks.
But you don't.
But I don't know of any scientific thing about that, because I could see if you're in a cold country and he says it's going to snow today and it's going to be so cold, but here you're in a warm state, and I don't know what the rain has to do with that. But I've heard that many times.
Tale that about the rain.
Yeah.
So if there is one piece of advice, we've got to wrap it up. What would you tell a person who wants to start, but they're having a hard time getting motivated to start exercising? When most people work and they get off at 5:00 and they're like, "Okay, I'm going to get a cheeseburger and I'm going to go watch the news." What is it that you can tell people briefly to get them motivated?
From a fitness standpoint and just a health club owner, keep the bag in the car. I call it your gym bag, and don't go home after work. Come straight
don't go
to
home
the gym.
after work.
If you go home,
don't feed the dog.
If you go home, you're not going to leave the house. So come straight to the gym right after work, and that's your only time to be able to work out unless you have a lunch hour. But never go home. If your goal is to come to the gym, do not go home first.
And plus, the gym is a great place if you're single to meet somebody, right?
Yeah, we have had a lot of couples that have met, got engaged, and became married.
Match.com.
Through our fitness center.
At Gold's Gym.
Yeah, they have something in common, and it's a
All
match
right.
made in heaven.
All right. What about you, Dr. Riddle? What's your what's your bit of advice for
people?
Well,
I would like them not to give up. From my experience, that after 3 or 4 weeks of continuous exercise, you do not just stop, you do today and go back next week. Just continue. And by 4 weeks, you increase your happy hormones, your endorphins. And once my patients are hooked to that point, they just do not want to give it up. So it seems very much. The first few weeks it's very difficult, the first 2 weeks. But if you can continue for up to 5 weeks, at that point you're hooked. It's almost an addiction. You cannot do without the gym.
The endorphins start
kicking in.
It's actually
and you
better than
started
sex,
feeling
right?
Good. Yeah, and you started feeling good, and you notice you start getting a little better shape. You can put your thumb in your pants waist.
Oh,
and
wow.
Then it's just
I'm going to the gym
You'll be motivated
tomorrow. Well, you heard it, you guys, from the experts. I'm Kathy Andrews. You've been listening to Health Matters. Thank you for listening. Tune in to us every Wednesday at 7:30 right here on 90.3 FM.